What's your fourth area of interest?
Fourth area of interest. Looking at consumer affairs and commerce, and the reason for that is medical and healthcare issues and reform. So on top of my experience as an EMT and a paramedic, or was not a paramedic, I didn't have the national registry, I was an EMT3 in New York, which is up there, and I was a team medic as an additional duty in Afghanistan. I came back and I got a degree in nursing, and I went into nursing administration instead of direct patient care due to the injuries to my back and the physical limitations I had there. And that exposed me to a lot of the challenges that we face from a medical care and infrastructure point of view. And then as a veteran who was in the VA, in the middle of the VA scandals in, from 2009 to 2014 and wait lists and whatnot, I've seen that. And as somebody who's worked with suicide prevention and various issues with the VA, I've seen challenges that we've run into just getting access. When we change over from one form to another with the CARES, I think it wasn't the CARES Act, but with the VA care in the community piece. I lost my dental care up here because when they renegotiated, they went at such a low rate and they made it so cumbersome and burdensome on the provider
that they won't do it.
That they won't even do it.
Right. Wow.
All right. That is not a health care concern, but that is definitely a barrier to good health care. Everybody says, let's add a tax and we'll throw this money at it and we'll fix the problem. And they think that's a silver bullet, and it's not. It's really not. When we start looking at those numbers, people, when they actually look at the real numbers, they go, whoa, oh no. It's not a question of just throwing money. It's a question of making it more efficient, finding ways to work across state lines, finding ways, and that goes to getting permission from Congress. If we want to do stuff across state lines, we have to get, enough time in the block for that provider. And that is a challenge that I would say is the third step. We can jump back into the middle in a second, but the third step is we need more providers.
Okay.
When was the last time we expanded the number of medical schools in the United States?
Good question. I wouldn't know.
How many medical schools do we have in New Hampshire?
Dartmouth.
And
that's it.
Oh, no kidding.
Yep.
One place.
Yep.
Yeah. So how many doctors are we retaining each year?
The retention rate for New Hampshire is so low that it's beyond belief.
Oh, so we're bleeding.
Because they could go elsewhere and make significant more money, and that's the logic.
So let's bring us down into that interim thing.
Okay.
We need to make a draw. We need to create a draw. Whether it's a tax benefit, I don't know. I don't know because I don't have ultimate supreme power. I'm not King George. I can't dictate how this is going to go. But you get into a room with 400 other individuals, and I don't care if you're on the left, you're on the right, you're on the bottom, you're on the top. Just go this way and let's make a cohort that can say, let's talk about this intelligently. Let's find a way to draw providers here. We are bleeding at providers. So step one, let's get instant access right now via telemedicine. Step two, let's create an incentive for these providers to stay here. My little brother's a doctor. He grew up here.
Okay.
He works in Connecticut. David Riss, Dr. Riss, his son is an ER doctor. He's out in Idaho.
Anyone who goes from New Hampshire to Connecticut obviously has
It's a marital thing. It's a family thing. So his family's down there. So but it's still that piece. Why not? Why can't we get providers here? We need to provide that incentive to bring them here. So that's that interim piece. And then that long-term piece is let's find a way to create more doctors. And that's a national level piece as well as a local level piece. We need supply and demand. You're getting a 15-minute block because that's the biggest block in their schedule. Right?
Unless you really raise a stink.
If you really raise a stink, then they're going to block off two of them, and they're going to give you a 99214, and they're going to charge extra for it. But each one of they with the new electronic medical records that came out of the ARRA and the ACA, everything's broken down into 5-minute blocks, and you either get a 10-minute block or a 15-minute block.
And that is an issue. National solutions for local problems.
Yeah, that never works. That never works. I already said it once. We are fiercely independent. We're fiercely independent. And at the same time, the solution for Bartlett is not going to be a solution for Jackson, is not going to be a solution for Manchester. Never mind a solution from California working for Conway. We've got to make sure that we use New Hampshire solutions to New Hampshire challenges. And that's one of those things that I've been harping on, is to make sure that we have that ability to focus on New Hampshire solutions that work for us.
Okay.